COPC was involved in shared savings with both commercial and Medicare Advantage payers. We were relatively successful, but felt that we could not begin to recognize the true value we were creating. And as a primary care group with, at that time, about 320 physicians, we were not capable of taking risk alone, and we actually needed a partner. We also realized, looking at our data, that our highest performing physicians actually made the least income in a fee-for-service world, and we needed to get into contracting mechanisms that allowed us to recognize the value we were creating for those physicians. And as you can imagine, as a large, relatively successful primary care group, we had lots of people calling, be they hospitals, insurance companies, or private equity or venture capital firms. We did not want to be purchased, and Agilent Health made a tremendous amount of sense for us. Why we chose Agilent Health was people. It was the process and the technology that they were able to bring to the table. It provided the ability for us together to build a program that created a better set of outcomes for our patients. And that capability still exists today. As physicians are joining us, they are entering into the same partnership with the same capabilities to have input into making us better. COPC physician engagement continues to be very, very high as it relates to Agilent Health. And that's evidenced by our high Net Promoter Score. Our physicians like this relationship, they're engaged in this relationship. We know that our patients are happy. We know that our performance in their eyes continues to get better. We know that because our quality numbers are better, our physicians are happy, and we're providing outstanding care for our patients. And much of it is because of this joint venture.
I believe independent primary care physicians deliver the best results. Primary care is the best answer to be the team leader, and we need good partners. We need to be interdependent, but not owned or employed or beholden. Before our partnership with Agilent Health, we were missing a sense of control and ownership of patient care. We needed a true partner and a business plan to allow us to improve our own lives in conjunction with the lives of our patients and communities. The partnership with Agilent Health has infused a hope and a confidence that we can be the doctors that we train to be. If we're going to win in this endeavor long term, we need investment, tools, and relevance. The investment stems the tide as we convert increasingly from fee-for-service towards risk. We need data, subject matter expertise, proven programs, and practice transformation in order to execute.
For the first time, having been with COPC for over 15 years, I am watching a real change in their attitudes. Particularly in physicians who have been around for a long time. They're taking more time with their patients. They're starting to get joy back in their life. After 3 years, I've essentially learned to speak 2 languages. I now have the language of a provider, the language of a payer, and I can leverage both of those to serve my patient better. I know how to navigate the system better. I know I can create programs within the system. And I know the resources are going to be available for my patients when I do it. But to see the opportunity now, after 3 years, particularly for the newer markets coming on board, where a lot of the build is now done, we're getting our footing, and where we can go from here, it's going to be incredible.
When we first came out of residency, we always hoped we'd be able to spend a lot of time with our patients and really work on outcomes instead of just seeing patients to see patients. This new business model with Agilon, and our version is called Paradigm Senior Care Advantage, has allowed me to financially, and with a much bigger team to take care of patients, to be able to reduce my patient slots from 25 to 18. In fact, I anticipate that my income will actually be higher in seeing less patients, but doing much more effective care, doing what's needed, not what is required of a schedule. And now I'm able to be who I want to be, which is spending more time with my patients and actually getting outcomes. We had always been looking for this, right? We've always been looking for value-based medicine. Agilon kind of fit into the spot where we were looking to go. I will say this, as a partner, Agilon has probably been our most credible and honorable partner we've ever had, because we've dealt with other physician groups, we've dealt with hospitals, insurance companies, myriad people, and This is the first true partnership I think we've ever had. We have done some recent surveys on our physicians, and 100% of them want to grow their Medicare and Medicare Advantage panels because of this risk program. 90% of our docs said they feel professionally satisfied a few times a week. 100% of them said that at least a few times a month they were completely satisfied. So that's really one of the things we're looking at, is taking care of the doctors as well. And this program seems to have helped with that, enjoying their job, because we do know this: happy doctors take good care of patients. I think most doctors are looking for this kind of model, where they're going to be still in charge of their own destiny, but it's going to allow them to get to the place they always wanted to be. So this is a vehicle for that transformation. We've always looked for it, couldn't find it, nobody was truly in it with us. So it's a very exciting time. In fact, I'm not sure I thought it would ever happen, and it's here.